I've had this platform for almost 5 years now, and I have never talked about borderline personality disorder, despite it being one of the most common diagnoses I see as an inpatient psych nurse. For the most part, I think this has been very intentional because I'm willing to argue that borderline personality disorder is the most stigmatized mental illness among those who know what it is, especially healthcare professionals. Because of this, I have felt like I don't really have anything to add to the conversation, and that it's much more important for us to listen to people that live with BPD and learn their perspectives versus my perspective as a professional. This is a community that has already been subjected to so much stigma and harm. I don't want to risk saying anything that's going to further contribute to that. And also in an inpatient setting, we are more so treating symptoms of BPD, things that may result because of BPD. For example, this population has a very high instance of suicide attempts and suicidal ideation. So that's typically what I see these patients for. Treatment for personality disorders tends to be very long-term therapy that focuses on cognitive restructuring and coping skills. And these are things that take a very long time to learn. And they're not things that, as a psychiatric nurse, I really focus on, and they're not really things that I'm trained in. So I don't feel like I can give a lot of input on that either. Sometimes a lot of the best information comes from learning about the patient experience, and I really do feel that with BPD, this is very, very important.